Explain the differences in imaging modalities used for assessing common skeletal pathologies, including their advantages and limitations. Answer. Imaging modalities commonly used for assessing skeletal pathologies include X-ray, computed tomography, CT, magnetic resonance imaging, MRI, and ultrasound, X-ray. Advantages: quick, cost-effective, and readily available, excellent for identifying fractures, dislocations, and some degenerative changes. Limitations: limited soft tissue contrast, and not suitable for imaging complex anatomy or supple bone marrow pathologies. CT. Advantages: provides detailed cross-sectional images, allowing for better visualization of complex fractures and joint pathologies. Superior for assessing bony structures and has a high spatial resolution. Limitations: higher radiation dose compared to X-ray, less effective for soft tissue evaluation. Advantages: offers excellent soft tissue contrast, making it ideal for assessing marrow pathologies, soft tissue tumors, and ligamentous injuries. No ionizing radiation exposure. Limitations: longer scan times, higher costs, and contraindications for patients with certain implants, e.g. pacemakers. Ultrasound advantages: no ionizing radiation, real-time imaging, and useful for guiding procedures. Good for evaluating soft tissue conditions and certain joint pathologies. Limitations: operator dependent, limited in assessing deep structures or complex bony anatomy. In summary, the choice of imaging modality should be based on the specific clinical question, considering the advantages and limitations of each technique. Describe the role of neuroimaging in clinical practice, emphasizing its applications in diagnosing nervous system pathologies. Answer. Neuroimaging plays a crucial role in diagnosing and managing various nervous system pathologies. The main modalities used include MRI, CT, and functional imaging techniques such as positron emission tomography or PET MRI. Applications: highly effective for visualizing brain structures, detecting tumors, assessing demyelinating diseases, e.g. multiple sclerosis, and evaluating vascular abnormalities, e.g. aneurysms. MRI can provide insights into brain morphology and detect changes in white matter integrity. Advantages: superior soft tissue contrast, no radiation exposure, and capability to assess both anatomical and functional changes, e.g. through FRET. Applications: rapid imaging for acute conditions such as hemorrhagic stroke and assessment of traumatic brain injuries. CT is also used for detecting skull fractures and guiding interventional procedures. Limitations: ionizing radiation exposure and less effective for soft tissue evaluation compared to MRI. Functional imaging, e.g. PET. Applications: used to assess brain metabolism, particularly in conditions like Alzheimer's disease and other dementias. PET imaging can help differentiate between Alzheimer's and other types of dementia based on glucose metabolism patterns. Advantages: provides functional information that can complement structural imaging findings. Neuroimaging is critical for accurate diagnosis, treatment planning, and monitoring of disease progression in various neurological disorders. Mr. Schmidt, a 45-year-old male, presents with persistent back pain and neurological symptoms such as numbness in his legs. After an initial X-ray showed no obvious fractures, what imaging modality should be recommended next and why? Answer. Given Mr. Schmidt's persistent back pain and neurological symptoms, the recommended imaging modality would be MRI of the lumbar spine. Justification: soft tissue evaluation. MRI provides excellent soft tissue contrast, making it ideal for assessing the intervertebral discs, nerve roots, and spinal cord. It can help identify conditions such as herniated discs, spinal stenosis, or tumors that might not be visible on an X-ray. Non-invasive. MRI is non-invasive and does not expose Mr. Schmidt to ionizing radiation, which is particularly beneficial given the repetitive nature of follow-up imaging that may be necessary for monitoring his condition. Neurological symptoms. The combination of back pain and leg numbness suggests potential nerve root compression or other neurological issues, which MRI can visualize effectively. In summary, an MRI is crucial in this scenario for further evaluation and to guide appropriate management based on the underlying cause of Mr. Schmidt's symptoms. Discuss the physiological principles behind the normal variants in imaging, providing examples of how they can be mistaken for pathologies. Answer. Normal variants in imaging can often mimic pathologies, leading to potential misdiagnosis. Understanding the physiological principles behind these variants is essential for accurate interpretation. Anatomical variants, example, os acromial, a condition where the acromion process of the scapula is not fully fused. On X-ray, this can appear as a fracture, but it is a normal variant. Physiological principle. This results from genetic variation in ossification processes which may not follow typical patterns. Bone density variants, example, increased bone density in certain regions, e.g. inostosis or bone islands, may be mistaken for lesions or tumors. Physiological principle. These changes are due to localized variations in bone metabolism and do not indicate disease. Soft tissue variants, example, lipomas can appear as masses on MRI. While these are benign fatty tumors, they may be confused with malignant tumors. Physiological principle. Variations in fat deposition can occur in normal individuals due to factors like genetics, age, and metabolic status. Understanding these principles helps radiologists differentiate between normal anatomical variants and true pathologies, thereby reducing unnecessary anxiety and interventions. Analyze the imaging findings associated with common pulmonary pathologies and their implications for patient management. Answer: imaging plays a vital role in diagnosing pulmonary pathologies. Key imaging findings include pneumonia. Imaging findings: consolidation on chest X-ray or CT, often localized in one lobe. Air bronchograms may be visible. Implications for management: identification of pneumonia may lead to immediate antibiotic therapy, and follow-up imaging can assess treatment response. Pulmonary nodules. Imaging findings: round opacities on chest X-ray or CT. Nodules smaller than 3 cm are generally considered benign, but characteristics such as speculation may suggest malignancy. Implications for management: nodules require careful follow-up imaging, e.g. CT surveillance or biopsy if suspicious features are present. Chronic obstructive pulmonary disease (COPD). Imaging findings: hyperinflated lungs with flattened diaphragms on chest X-ray. CT may show bullae formation and airway remodeling. Implications for management: imaging findings can guide treatment decisions regarding bronchodilator therapy, corticosteroids, and the need for pulmonary rehabilitation. Understanding these findings is essential for timely intervention and effective patient management strategies in pulmonary care. Define the role of imaging in the assessment of muscular system trauma and disease, including specific imaging modalities utilized. Answer: imaging is critical in assessing trauma and disease of the muscular system, with various modalities providing complementary information. MRI role: MRI is the gold standard for assessing muscle tears, strains, and chronic conditions such as myopathy. It provides detailed information about muscle architecture, edema, and scar tissue. Indications: it is particularly useful in sports medicine for evaluating hamstring injuries, quadriceps strains, and rotator cuff tears. Ultrasound role: ultrasound offers real-time imaging and is highly effective for guiding injections and assessing superficial muscles. It can visualize muscle morphology, tears, and hematomas. Indications: useful in acute settings for immediate assessment of soft tissue injuries, particularly in athletes. CT is less commonly used for muscular assessments but can be beneficial in evaluating complex cases involving the chest and abdomen. Indications: CT can be useful in identifying deeper structures or when other modalities are inconclusive. By utilizing these imaging techniques, clinicians can effectively diagnose muscular injuries and plan appropriate management strategies. Evaluate the importance of vascular imaging in interventions and its impact on treatment outcomes. Answer: vascular imaging is crucial for diagnosing and managing vascular diseases and guiding interventions. Key modalities include ultrasound, CT angiography, ETA, and magnetic resonance angiography, MRA. Ultrasound importance: provides real-time imaging for assessing blood flow and identifying occlusions or abnormalities in superficial vessels. Impact on treatment outcomes: guides procedures such as thrombolysis or catheter placement with minimal risk to the patient. CT angiography importance: non-invasive technique that provides detailed images of blood vessels and can visualize complex vascular anatomy. Impact on treatment outcomes: helps in preoperative planning, allowing surgeons to understand the extent of disease, leading to better surgical outcomes and reduced complications. Magnetic resonance angiography importance: excellent for evaluating vascular conditions without the use of ionizing radiation. Impact on treatment outcomes: useful in assessing vascular malformations or planning for endovascular therapies, which can enhance patient safety and efficacy of treatment. The integration of vascular imaging into clinical practice significantly enhances diagnostic accuracy and optimizes treatment strategies. Discuss the role of advanced imaging techniques in the evaluation of cardiac anatomy and pathology. Answer: advanced imaging techniques, including cardiac MRI and CT, have revolutionized the evaluation of cardiac anatomy and pathology. Cardiac MRI role: provides detailed visualization of cardiac structures, myocardial tissue characterization, and assessment of cardiac function. Applications used in evaluating conditions such as cardiomyopathy, myocarditis, and congenital heart defects. MRI can assess myocardial viability, which aids in therapeutic decision-making. Cardiac CT role primarily used for coronary artery assessment through coronary CT angiography (CTA). It provides non-invasive evaluation of coronary artery disease (CAD) applications. CCTA is valuable for identifying coronary artery stenosis and ruling out CAD in patients with chest pain, contributing to risk stratification and management. Functional imaging e.g. nuclear stress testing role assess myocardial perfusion and viability under stress conditions. Applications useful for evaluating ischemic heart disease and determining the need for revascularization procedures. Overall, advanced imaging techniques enhance diagnostic accuracy and provide critical information for managing cardiac conditions effectively. Explain the pathophysiological principles underlying the imaging findings in lung cancer and how they guide clinical management. Answer: imaging findings in lung cancer are closely tied to the underlying pathophysiological processes of tumor growth and metastases. Primary tumor identification. Imaging findings. Lung cancer typically presents as a solitary pulmonary nodule (SPN) on chest X-ray or CT. Characteristics such as spiculation or irregular borders may suggest malignancy. Pathophysiology. These features indicate aggressive growth patterns and potential infiltration into surrounding tissues. Metastatic disease. Imaging findings. Presence of lymphadenopathy or distant metastases e.g. to the liver or bones can be identified on CT or PET scans. Pathophysiology. The ability of cancer cells to invade local structures and disseminate through the lymphatic and vascular systems contributes to these findings. Guiding management. Surgical planning. Understanding the tumor's size, location, and extent of spread informs surgical resection strategies. Therapeutic decisions. Imaging can help determine the appropriateness of chemotherapy or radiotherapy based on tumor staging as defined by the TNM classification system. Tumor node metastases. By correlating imaging findings with pathophysiological principles, the clinicians can tailor management strategies for lung cancer effectively. Analyze the role of imaging in the assessment of common respiratory system pathologies, emphasizing how findings influence treatment decisions. Answer: imaging plays a critical role in assessing respiratory system pathologies, guiding treatment decisions based on the findings. Pulmonary embolism (P). Imaging findings. CT pulmonary angiography (ETPA) is the gold standard for diagnosing PE, revealing filling defects in pulmonary arteries. Influence on treatment. Positive findings prompt immediate anticoagulation therapy to prevent further complications, such as right heart failure. Chronic obstructive pulmonary disease (COPD). Imaging findings. Chest X-ray may show hyperinflation and flattened diaphragms. A CT can reveal emphysematous changes in airway modeling. Influence on treatment. Imaging findings assist in assessing the severity of the disease, guiding the initiation of bronchodilator therapy, corticosteroids, and referral for pulmonary rehabilitation. Interstitial lung disease (ILD). Imaging findings. High-resolution CT is crucial for identifying patterns such as ground glass opacities, reticular patterns, and honeycombing. Influence on treatment. Accurate characterization of ILD can determine the need for immunosuppressive therapy or lung transplantation. Through the integration of imaging findings, clinicians can make informed treatment decisions tailored to the specific respiratory pathology and its severity. What are the key differences between ionizing and non-ionizing radiation? Discuss the implications of each type in medical imaging. Answer: ionizing radiation includes high-energy electromagnetic waves like X-rays and gamma rays capable of removing tightly bound electrons from atoms, which can lead to cellular damage and increased cancer risk. Non-ionizing radiation, such as ultrasound and MRI, does not carry enough energy to ionize atoms but can still cause molecular vibrations or heat. Implications in medical imaging. Ionizing radiation, commonly used in X-ray and CT imaging, it allows for detailed visualization of structures but necessitates strict safety protocols to minimize patient exposure. The ALAI as low as reasonably achievable principle must be applied to limit doses. Non-ionizing radiation, used in MRI and ultrasound, it is generally considered safer as it does not pose a risk of ionization. However, precautions are still necessary, such as ensuring no metal implants are present for MRI. Explain the concept of radiation dose measurement. How are dosimeters used in practice and what types of dosimeters are most commonly employed in radiology? Answer: radiation dose measurement quantifies the amount of ionizing radiation absorbed by an object or individual. In radiology, it is crucial for ensuring patient safety and compliance with regulatory standards. Dosimeters are devices used to measure exposure to ionizing radiation. They are worn by healthcare professionals and can also be placed on patients during procedures. Common types of dosimeters: thermoluminescent dosimeters (TLDS). These absorb radiation energy and release it as light when heated, which can be quantified to determine exposure levels. Film batch dosimeters utilize photographic film to record exposure at a degree of darkening indicates the level of radiation received. Electronic personal dosimeters (EPS) provide real-time exposure readings and are essential for monitoring high-risk procedures. Regulatory guidelines: according to the International Atomic Energy Agency (IAEA), regular monitoring using dosimeters ensures compliance with established dose limits to protect staff and patients. Mr. Schmidt is a radiologic technologist who has been working with X-ray machines for several years. Recently, he has been informed that he is exceeding the recommended annual dose limit for radiation exposure. What steps should Mr. Schmidt take to reduce his radiation exposure, and what safety standards should he consider? Answer: to reduce his radiation exposure, Mr. Schmidt should implement several strategies. ALARA principle: he should adhere to the ALARA principle, which emphasizes keeping radiation doses as low as reasonably achievable. Personal protective equipment (PPE): use lead aprons, thyroid shields, and lead glasses to protect against scatter radiation. Distance and shielding: maintain an appropriate distance from the radiation source and utilize shielding, e.g. lead barriers whenever possible. Equipment maintenance: ensure that all X-ray equipment is well maintained and regularly inspected to operate efficiently and safely. Training and protocol compliance: attend safety training sessions to stay updated on best practices and institutional protocols for minimizing exposure. Safety standards: the American National Standards Institute (ANSI) provides guidelines regarding permissible dose limits and radiation safety practices that should be followed. What is the significance of filtration and collimation in X-ray imaging? Explain how each process contributes to patient safety and image quality. Answer: filtration and collimation are essential processes in X-ray imaging that enhance both patient safety and image quality. Filtration: this involves the use of materials, usually aluminum, placed in the X-ray beam path to absorb low-energy photons that contribute to patient dose without enhancing image quality. By filtering these out, the average energy of the X-ray beam increases, improving image quality and reducing unnecessary exposure. Collimation: this process involves narrowing the X-ray beam to the area of interest. It minimizes the irradiated area, reducing scatter radiation and thus improving the contrast and sharpness of the image. Collimation also protects surrounding tissues from unnecessary exposure. Regulatory guidelines: the American College of Radiology (ACA) recommends appropriate collimation to limit exposure, aligning with the principles of patient-centered care and minimizing radiation risks. Discuss the biological effects of radiation exposure, differentiating between deterministic and stochastic effects. Provide examples of each and their relevance in radiology. Answer: the biological effects of radiation exposure can be categorized into two main types: deterministic and stochastic effects. Deterministic effects: these occur above a certain threshold dose and become more severe with increased exposure. They are predictable and include effects such as skin erythema, radiation burns, and cataracts. In radiology, high doses during therapeutic radiology may lead to such effects. Stochastic effects: these effects do not have a threshold and may occur randomly, increasing with the dose but without a predictable pattern. The most significant stochastic effect is cancer induction. In radiology, even low doses from diagnostic imaging can contribute to this risk over a lifetime, emphasizing the need for the ALARA principle. Regulatory guidelines: the National Council on Radiation Protection and Measurements (SOP) provides dose limits and recommendations to mitigate these effects in clinical practice. What are the components of an X-ray machine, and how does each component contribute to the overall function of the imaging system? Answer: an X-ray machine consists of several key components, each playing a vital role in the imaging process. X-ray tube: the heart of the machine where X-rays are generated. It includes a cathode, electron source, and an anode, target for electron bombardment, producing X-rays through bremsstrahlung and characteristic radiation. Filtration system: removes low-energy X-rays from the beam to reduce patient dose, enhancing image quality. Collimator: shapes and limits the X-ray beam to the area of interest, improving image contrast and reducing exposure to surrounding tissues. Image detector: converts X-ray photons into a visible image. This may include film-computed radiography, CR, or digital radiography doctor systems. Control console allows the radiologic technologist to set exposure parameters, ensuring optimal image quality while minimizing patient dose. Power supply provides the necessary energy for the X-ray tube, controlling the two current and voltage to produce the required X-ray beam. Describe the various safety standards and regulations governing radiation safety in medical imaging. What are the key organizations involved and what roles do they play? Answer: radiation safety in medical imaging is governed by various safety standards and regulations established by key organizations, including International Atomic Energy Agency (IAEA), provides international guidelines and standards for radiation safety, including recommendations for patient protection and staff training. National Council on Radiation Protection and Measurements (SERP) offers guidelines on permissible exposure limits and safety practices, addressing both patient and occupational radiation safety. U.S. Food and Drug Administration (FDA) regulates the safety and effectiveness of medical imaging equipment, ensuring compliance with performance standards. American College of Radiology (ACA) develops appropriateness criteria for imaging procedures, promoting best practices in radiology to enhance patient safety. Radiological Society of North America (RSNI) focuses on research, education, and advancements in radiology, contributing to the development of safety protocols. Key roles: these organizations collaborate to establish regulations that ensure radiation safety, promote education, and support continuous improvement in imaging practices. Discuss the principles of patient dose reduction techniques in radiology. What strategies can be employed to minimize exposure while maintaining diagnostic image quality? Answer: patient dose reduction techniques are vital for minimizing exposure without compromising the quality of diagnostic images. Key strategies include optimization of exposure parameters, adjusting factors like AVP, interval, peak, mass, milliampere seconds, and exposure time based on the patient's size and the clinical question, aligning with the ALARA principle, use of automatic exposure control. C systems automatically adjust the exposure based on the patient's anatomy and density, ensuring optimal image quality with minimal exposure. Collimation and beam limiting, carefully collimate the X-ray beam to the area of interest, reducing unnecessary exposure to surrounding tissues. Utilizing advanced imaging technologies, implementing digital radiography and computed tomography techniques that allow for low doses while enhancing image quality through post-processing. Regular quality control checks, conducting routine maintenance and calibration of imaging equipment to ensure optimal performance and safety standards are met. Explain the concept of risk assessment and management in the context of radiation exposure. How should radiologic technologists approach risk evaluation in their practice? Answer: risk assessment and management in radiation exposure involve evaluating the likelihood of adverse effects resulting from radiation exposure and implementing strategies to mitigate these risks. Key steps: identify radiation sources. Technologists should be aware of all potential sources of radiation exposure in their practice, including equipment and procedural protocols. Evaluate risks. Assess the potential risks associated with different imaging modalities and techniques, considering factors such as patient demographics and underlying health conditions. Implement control measures. Adopt safety protocols and techniques to minimize exposure, e.g., shielding, appropriate collimation, and adherence to ALARA principles. Continuous education. Stay updated on the latest safety guidelines, risk assessment strategies, and technological advancements to improve practice and safety. Monitoring and reporting. Regularly monitor exposure levels using dosimeters and report any instances of exceeding recommended limits to relevant authorities. What are the key differences between exposure, absorbed dose, and dose equivalent in radiation measurement, and how are they used in clinical radiology? Answer: understanding the different quantities in radiation measurement is crucial for accurately assessing patient and staff exposure. Exposure measures the amount of ionization produced in air by X-rays or gamma rays. It is often quantified in coulombs per kilogram (CEG) or the traditional unit Röntgen. Exposure is used mainly in air and doesn't directly reflect the dose absorbed by tissues. Absorbed dose refers to the amount of energy deposited by ionizing radiation per unit mass of tissue. It is measured in gray Ji, where 1 Ji equals the absorption of 1 joule of energy per kilogram of tissue. This metric is crucial for evaluating the actual amount of radiation that tissues receive. Dose equivalent. This adjusts the absorbed dose by a radiation weighting factor to account for the biological effectiveness of different types of radiation. It is measured in sieverts SB, which accounts for radiation type e.g., alpha particles are more biologically damaging than X-rays and helps assess the potential biological impact. In clinical practice, these measurements help determine safe radiation levels and ensure that patient and staff exposures stay within recommended limits. Regulatory agencies like the International Commission on Radiological Protection (ICOP) set guidelines for dose limits. Discuss the role of imaging algorithms in diagnostic pathways for common conditions. How do these algorithms contribute to effective patient management? Answer: imaging algorithms are structured approaches that guide the selection and interpretation of imaging studies for specific clinical scenarios. They typically outline the recommended sequence of imaging modalities based on the presenting symptoms and clinical history. For instance, in a patient presenting with suspected appendicitis, the algorithm may recommend an initial ultrasound followed by a CT scan if the ultrasound results are inconclusive. The role of imaging algorithms in diagnostic pathways includes standardization of care. By following evidence-based guidelines, imaging algorithms help standardize the diagnostic process, reducing variability in practice. Efficiency in diagnosis. Algorithms improve the efficiency of diagnosis by directing healthcare professionals to the most appropriate imaging modality based on clinical indications. This reduces unnecessary delays in treatment. Multidisciplinary approach. Effective implementation of these algorithms often requires collaboration among various healthcare providers, enhancing the quality of patient care. Cost effectiveness. By prioritizing certain imaging tests, algorithms can help avoid unnecessary procedures and reduce overall healthcare costs. Mr. Schmidt, a 60-year-old male, is referred for a CT scan of the abdomen to investigate chronic abdominal pain. During the informed consent process, he expresses anxiety about the radiation exposure. As the radiologist, how should you address his concerns while ensuring compliance with ethical standards? Answer: in addressing Mr. Schmidt's concerns regarding radiation exposure during the informed consent process, the following steps should be taken. Educate the patient. Begin by providing a clear explanation of the benefits of the CT scan. Emphasize that the scan is crucial for diagnosing potential underlying conditions that could explain his chronic abdominal pain. Discuss radiation risks. Explain the principles of radiation safety, including the concept of ALARA as low as reasonably achievable. Inform Mr. Schmidt about the effective dose of radiation he would receive and how it compares to natural background radiation levels. Alternative imaging modalities. Discuss any possible alternatives that may pose less radiation risk, such as an ultrasound or MRI, and clarify that these options may have limitations in visualizing certain structures. Informed consent documentation. Ensure that all discussions are well documented. This includes Mr. Schmidt's concerns, the information provided, and his understanding of the risks and benefits. Follow up. Offer to answer any further questions he may have, reassuring him that his comfort and understanding are priorities. Explain the importance of effective communication between radiologists and clinicians during radiology consultations. What strategies can be employed to enhance this communication? Answer: effective communication between radiologists and clinicians is essential for optimal patient management. The significance includes clarity in imaging requests. A thorough understanding of the clinical question helps radiologists select appropriate imaging techniques and protocols, leading to accurate diagnosis. Timely results. Rapid and clear communication of imaging findings is critical, especially in emergency situations where timely intervention can significantly affect patient outcomes. Clinical context. Clinicians provide valuable clinical context that can influence interpretation. Understanding the patient's history, symptoms, and previous treatments can help radiologists tailor their reports more effectively. Follow-up recommendations. Effective communication allows for appropriate follow-up imaging or intervention recommendations based on the findings. Strategies to enhance communication. Standardized reporting. Use structured reporting templates that highlight critical findings and recommendations for action. Regular multidisciplinary meetings. Engage in scheduled discussions with clinical teams to review complex cases and refine communication processes. Use of technology. Implement digital communication platforms, e.g. PACS-EMA for real-time updates and easier access to imaging studies and reports. In summary, enhancing communication fosters collaboration, improves patient outcomes, and streamlines the healthcare process. What are the ethical considerations involved in the informed consent process for radiological procedures, particularly in high-risk scenarios? Answer: the informed consent process in radiology is governed by ethical principles such as autonomy, beneficence, non-maleficence, and justice. Key ethical considerations include autonomy. Patients have the right to make informed decisions regarding their care. Radiologists must provide clear, comprehensive information about the procedure, risks, benefits, and alternatives. Risk-benefit assessment. In high-risk scenarios, e.g., procedures involving contrast agents, it's crucial to ensure that the patient understands both the potential benefits and the inherent risks, including allergic reactions or complications. Voluntariness. Consent must be given voluntarily, without coercion. Patients should feel free to ask questions and withdraw consent at any time. Documentation. Ethical practice mandates proper documentation of the consent process, ensuring that the patient's understanding and agreement are recorded accurately. Capacity. Assess the patient's capacity to understand the information provided. In cases where patients lack capacity, a surrogate decision maker should be involved in the consent process. A patient presents with an unexpected finding on an imaging study that may indicate a serious condition. What steps should the radiologist take to ensure proper follow-up and management of this case? Answer: when a radiologist encounters an unexpected finding that may indicate a serious condition, the following steps should be taken. Immediate review and confirmation. Carefully review the images to confirm the finding and assess its clinical significance. Timely communication. Notify the referring clinician immediately to discuss the finding, its implications, and recommend further investigation or intervention as necessary. Written report. Document the finding in a detailed report, including descriptions, possible differential diagnoses, and recommended follow-up actions. Patient communication. If appropriate, advise the clinician to inform the patient about the finding, its significance, and the next steps in management. Follow-up protocol. Establish a clear follow-up protocol to ensure that the patient receives timely additional imaging or referrals. This may include scheduling subsequent appointments or tests. Multidisciplinary team collaboration. Engage with a multidisciplinary team to discuss the case and determine the best course of action, especially in complex situations requiring specialized care. What are the best practices for preparing patients for radiological procedures to ensure their safety and comfort? Answer: preparing patients for radiological procedures involves several best practices to ensure safety and comfort. Pre-procedure information. Provide detailed information about the procedure, including its purpose, what to expect, and potential risks. This reduces anxiety and enhances patient cooperation. Informed consent. Ensure the patient understands the procedure and obtains informed consent. This includes discussing any contraindications, such as allergies or existing medical conditions. Patient comfort measures. Assess and address patient comfort by providing options such as warm blankets, adjusting room temperature, and ensuring privacy during the procedure. Managing anxiety. Utilize techniques to manage patient anxiety, such as deep breathing exercises, calming verbal reassurance, or offering sedation options when appropriate. Post-procedure care. Inform patients about post-procedure expectations, including potential side effects and when they can resume normal activities. Accessibility. Ensure that the procedure area is accessible for patients with mobility issues, providing necessary accommodations and support. Discuss the implications of documentation and best practices in the informed consent process for radiological procedures. Answer: documentation and best practices in the informed consent process are crucial for several reasons. Legal protection. Thorough documentation provides legal protection for the radiologist and healthcare facility by demonstrating adherence to ethical and legal standards in the informed consent process. Clarity and understanding. Well-documented consent forms outline the procedure details, risks, benefits, and alternatives, ensuring that patients have a clear understanding of what they are agreeing to. Continuity of care. Proper documentation facilitates communication among healthcare providers, ensuring continuity of care and enabling other clinicians to be aware of the patient's consent history. Quality assurance. Documentation serves as a basis for quality assurance reviews, helping to identify areas for improvement in the consent process and enhancing patient safety. Compliance with regulations. Adhering to best practices in documentation ensures compliance with institutional policies, as well as local and national regulations governing informed consent. Mr. Keller, a 45-year-old male, presents for a CT scan after an accident resulting in abdominal trauma. During the imaging, the technician notices he appears to be distressed. What strategies can the radiologist implement to manage Mr. Keller's anxiety during the procedure? Answer: to effectively manage Mr. Keller's anxiety during the CT scan, the radiologist can implement the following strategies. Pre-procedure communication. Before the procedure, the radiologist or technician should explain the scanning process, what Mr. Keller can expect, and the importance of staying still. Providing a clear overview helps alleviate fears of the unknown. Reassurance. Offer reassurance about the safety of the procedure and the fact that it is a routine process. A calming demeanor can help reduce anxiety. Comfort techniques. Provide comfort measures such as warm blankets or the option to listen to music during the scan to create a more relaxing environment. Encourage questions. Encourage Mr. Keller to ask questions and express his concerns. Addressing his inquiries can empower him and reduce anxiety. Breathing exercises. Teach simple breathing exercises to help Mr. Keller manage his anxiety. Deep, slow breaths can help calm the mind and body. Support person. If possible, allow a support person to accompany him, which can provide additional comfort and reassurance. What is the significance of effective interpretation of imaging findings in radiology consultations? Answer: the significance of effective interpretation of imaging findings during radiology consultations is multifaceted. Accurate diagnosis. The primary objective of imaging is to aid in diagnosing medical conditions. Effective interpretation ensures that radiologists can identify abnormalities and communicate critical findings to the clinical team accurately. Patient management decisions. Clear interpretation influences the next steps in patient management, including further testing, referrals to specialists, or immediate interventions. Risk assessment. Radiologists must assess the potential risks associated with findings, such as the likelihood of malignancy in a detected lesion, guiding appropriate follow-up actions. Interdisciplinary collaboration. Effective interpretation fosters collaboration among healthcare providers, as accurate reports enable clinicians to make informed decisions and improve patient outcomes. Education and training. Radiologists must continuously update their skills and knowledge in interpreting imaging findings, as advancements in technology and emerging diseases require ongoing education. Discuss the role of a multidisciplinary approach in patient care within the context of clinical radiology. Answer: a multidisciplinary approach in clinical radiology enhances patient care through several key roles. Comprehensive evaluation, involving various specialists, e.g. surgeons, oncologists, primary care physicians, allows for a more holistic assessment of the patient's condition, considering all relevant medical factors. Enhanced treatment plans. Collaboration among diverse healthcare professionals leads to the development of comprehensive treatment plans that address all aspects of the patient's health, improving outcomes. Shared expertise. Each discipline brings its expertise, enriching the diagnostic process. For example, the integration of radiology with pathology can enhance the understanding of disease processes and treatment effects. Improved communication. Regular multidisciplinary meetings facilitate effective communication, ensuring that all team members are aligned in their approach to patient care and can share important findings promptly. Patient-centered care. This approach focuses on the patient's needs, preferences, and values, ensuring that care is tailored to individual circumstances and improving overall satisfaction.